first-line management of chronic non-malignant pain is non-pharmacological therapies, including education, physical activation, and psychology. And non-opioid medicines are part of the first-line response, delivered as a patient-centred, multidisciplinary approach. Non-pharmacological management of all types should be optimised as much as possible before and during the trial, because the opioids should never be seen as a monotherapy approach. The aim of the trial is to determine the opioid responsiveness of the pain that the patient has, as not all pain is nociceptive and therefore not all pain will respond well to opioids, which are essentially an anti-nociceptive type of analgesic. But also the lowest dose needs to be measured against the functional benefits that it gains, rather than just the actual number pain score that the patient gives, because patients will often titrate their level of activity to the level of pain that they're comfortable with. So you need to be checking on their function as well as just on their level of pain. The trial can include reaching an agreement with the patient beforehand about the treatment expectations, the dose range that you're willing to explore, the duration and the criteria for starting and stopping the trial. Also, you need to set a review period and define an exit strategy so that both you and the patient understand that the time may come where these medications will either have served the purpose that you had in mind for them or they won't. And you will avoid a common situation where the patient is unsure about whether there was a benefit that was attained or not, or they may report something that was irrelevant to the actual aims of the trial and use that as grounds for wanting to continue. So this can be a challenging conversation to have with a patient, and in this demonstration the GP uses a motivational interviewing during a challenging conversation to help achieve a positive outcome.
Hi Elizabeth, how are you?
Call me Liz.
Okay Liz, thanks for that.
I'm just terrible. I'm in so much pain.
I'm sorry to hear that. Can you tell me a little bit more about the pain?
Well, I just can't do anything. I can't do the housework. I can't do things that I should be doing around the house. I can't do any shopping for myself. At night time, it seems to be the worst for me because I just can't sleep and I'm tossing and turning, and I just don't know what to do.
So I can hear that the pain is really starting to affect your everyday activities, including your sleep, so it must be really tough. Could you tell me a bit about how physiotherapy and your medications are going?
Yes. I'm just exhausted, and also, like, I've still got the pain. I don't move really well, and I just feel so desperate. I just need something to help me with this pain.
Yeah, I understand your feelings of desperation. I would like to talk a little bit more about your physiotherapy and medications. Is that okay?
Yes, okay.
So I want to talk to you about a group of pain medicines called opioids. What do you know about opioids?
I don't know anything about opioids. I remember once seeing something on television about them, but I don't remember anything.
Would it be okay if I shared some information about opioids with you?
Yes, thank you.
Fantastic. So opioid pain medication works on the central nervous system, and it slows down the nerve signals between your brain and your body, and this helps to reduce feelings of pain, and I expect it will for you. Now, while opioids can provide some short-term relief, it is important to understand that they come with benefits as well as potential harms and side effects. So some of the short-term side effects of opioids include confusion, drowsiness, nausea and constipation. Opioids can also actually potentially affect your breathing and slow down your breathing if taken in large doses or large quantities. Some of the more long-term effects of opioids can include So, what are your thoughts about opioids, and are there any things you'd like to address or discuss further?
Just seems really scary to me, and I'm not sure whether it's worth going down that track for me.
And look, I can understand your concerns. You're worried that the negatives might outweigh the potential benefits. And of course, it's entirely up to you whether you choose to take this medicine or not, because at the end of the day, it's your choice how you choose to manage the pain. But keep in mind that we'll work out a plan that maximises the benefits and minimises the harms. Would you like to hear a little bit more about how we might go about starting an opioid?
Yes, I think I will.
So the plan would be to actually start taking an opioid over a short period of time and see how your pain reacts to that, so we can find the appropriate dose for you. We want to get you to get back to doing the things you used to be able to do before the pain started. You can also opt out of taking the opioid at any time. How does that sound?
Yeah, that sounds good.
Are there any questions you might have about taking or starting an opioid at all that you'd like to talk about further?
Yes, about the length of time. You know, you said a short period. How long is a short period?
That's a very good question, and I'm glad you asked it. So for most people, an acceptable period is about 8 weeks or so. So you would be checking in with me quite regularly over that time, perhaps every week or so, and we'd be making sure that the medicine is working the way it should to reduce your pain, but we'd also be checking in to see if there are any side effects to address. Let's say the opioid does work to reduce your pain. What are some of the things you'd like to be able to do?
I'd love to be able to shop. I'd love to be able to do the things around the house that I can't do at present. I'd love to be able to sleep at night. That would be really good.
That would be great, wouldn't it? So how about we agree that those activities you mentioned, such as the shopping, housework and being able to sleep again, are the goals of therapy in this case. Would you agree with those?
Yes, yeah, that makes sense to do that, thank you.
That's great. Now we also need to discuss what happens if the pain medicine doesn't help to reach those goals. What are your thoughts on that?
I'm not sure. Maybe 8 weeks is too short and we need to keep it going for a while.
I can understand why you would want to do everything you can to help reduce the pain, and you're probably wondering whether taking the medicine for longer will give it a better chance of working. Do you mind if I provide you with some more information on that?
Yes, please.
So as mentioned earlier, there are potential harms the longer you take an opioid, and the stronger the dose, the more likely there are for harms to occur.
I don't want anything like that to happen.
Yeah, and look, I agree, and I think the best approach for you would be to slowly stop taking the opioid if you're not getting any benefit. So if you were to start an opioid, would you agree that if it doesn't help to achieve your goals, you would slowly stop taking it?
Yes, I agree with that.
I'm glad to hear we're on the same page. What I'd like to do now is write down everything we've discussed and agreed upon in the notes, in a pain management plan for you. I'll also provide you with some resources that you can take at home and have a read. And I'd like you to come back and see me in a couple of days, perhaps a week, where we can answer any further questions you might have and start the medicine then. Now, just a gentle reminder, if you have any other questions or concerns in the meantime, feel free to call us or pop back in and see me. How does that sound?
Wonderful, it sounds wonderful, thank you.